I would like to open by paying tribute to social care staff for all they've done during the pandemic, and to recognise that they too suffered bereavement when they lost residents to COVID who they'd been looking after for a long time. Instead of sympathy, they often faced criticism and attack in the media. Like the NHS, social care has faced huge pressures during the COVID pandemic, so it was shocking that it wasn't even mentioned in the budget at all. While the Chancellor claimed the UK was in good shape when COVID hit due to the government's management of public finances, actually it came at the end of a decade of austerity, with the NHS on its knees and an 8 billion social care funding gap in England alone. Service cuts had led to under-provision, with Age UK identifying that almost 1.5 million people are not getting the support they need. While most think of frail elderly people when they talk about social care, it is also critical to allow those facing end of life to be at home if that's what they wish, and to ensure younger people with a disability can participate fully in society. The government's Green Paper, first announced in 2017, has been postponed yet again, despite the Prime Minister boasting in the 2019 election that he had a plan for social care, which was ready to go. Maybe he was mixing it up with his oven-ready Brexit plan. More recently, we've been told the delay is due to cross-party discussions, but I certainly haven't seen anything, and nor apparently has the Shadow Care Minister. Several MPs in this debate have suggested that the government should propose an insurance-based model, and Germany and Japan are often held up as examples. However, closer examination shows that both systems have increasing shortfalls and that co-payments are therefore growing markedly. Taxation still provides the greatest solidarity and security. The Secretary of State has announced plans to reverse some of the most damaging aspects of the Health and Social Care Act and promote integration of health and social care. Of course, the devil is in the detail, and there was very little of that about social care in the White Paper. Scotland faces exactly the same issues as the rest of the UK, with an ageing population, a growing need for social care support, and the challenge of retaining and recruiting care staff, particularly with new visa requirements increasing the difficulty in recruiting from the EU. However, there are significant differences in both the provision and structure of health and social care in Scotland. After devolution more than 2 decades ago, the structures of the healthcare market, including hospital and primary care trusts, and the purchaser-provider split were reversed, and the Scottish NHS returned to being a single public body with local services provided by geographical health boards. Since 2014, Scotland has been working on integrating the NHS with social care through the establishment of integrated joint boards. They manage half of the total Scottish healthcare budget for the provision of all community services. Of course, COVID highlighted how much further we have to go, as social care is a much more fragmented landscape. The pandemic, however, stimulated a lot of close working, including projects I was part of during the first wave. One involved colleagues from acute medicine, geriatrics, and the local hospice holding online meetings with care home staff to discuss difficult cases and provide advice and training in symptom management and end-of-life care. The other was to try and identify unpaid carers, who often grow into the role so gradually they don't recognise the part they play. The aim is to reach out to them when they attend their local community pharmacy and encourage them to make contact with our local carers hubs, where they can access support, benefit advice, PPE, or even just a chat. Due to their pivotal role, unpaid carers are now being invited forward to receive the vaccine. Having been involved in redesign projects over many years as a breast cancer surgeon, it was fantastic to see the usual barriers to innovation simply collapse, and the relationships formed during the pandemic will definitely accelerate integration going forward. Due to its size and rural nature, Scotland already had significant digital health infrastructure, but video consultation systems such as Near Me were extended to all areas, and care homes were provided with devices and digital support to connect staff and residents both to their families, but also when needed to the NHS. The Scottish Government underwrote sick pay to ensure that staff could isolate if necessary. And as well as providing PPE to local social care providers, health boards offered access to NHS locum banks to reduce the need for agency staff and ensure safe workforce levels. Scotland is unique among the 4 nations in having provided free personal care to those over 65 since 2002, with the provision increased in 2011 and the age threshold removed in April 2019 by Frank's Law, named after the footballer Frank Coppell, who developed early onset dementia. Such provision encourages people to stay at home, which most of us would prefer, and 2/3 of social care is provided in people's own homes. This means there's a need for a strong home care sector, as well as residential and nursing care homes. It's important to remember that social care is delivered by people for people. So it's critical to recognize the importance of relationships and the need for continuity, dignity, and respect. Social care staff also need respect for their skill and dedication and what they do for those we love. Part of that recognition is that care staff should be paid properly for a tough job that most of us couldn't do. The Scottish Government has funded the real living wage for care staff since 2017. They fund overnight sleepovers at the full rate and provided a 3% pay rise last year. Social care staff in Scotland have also received the same £500 thank you payment as their NHS colleagues this month. Unfortunately, the UK government refused to exempt it from tax or benefit deductions. Care staff should not be described as unskilled workers, as we hear from the Home Office, just because they are paid too little. That fails to recognise the difference between wealth and worth. As many MPs have said this afternoon, caring needs to become a career, not a low-paid stopgap before getting a better job on the checkout at Tesco's. However, it isn't just about basic pay rates. It's about overall terms and conditions, the ability to take pride in one's work through having an ongoing, satisfying relationship with the person receiving care, not just a rushed 15-minute transaction. Last autumn, the Scottish Government commissioned an independent review of adult care in Scotland, which has now been published, the Feely Report. This proposes the creation of a national care service with national contracts, clinical standards, training and terms and conditions to ensure greater equity and consistency across Scotland. It promotes a human rights-based approach for the care recipient, with the principle of seeing social care as an investment rather than just a financial burden, and that it should allow everyone to participate fully in society. One recommendation is that all non-residential services should be provided free in the same way as healthcare. We will be the next generation of care users, whether as a recipient of care or as an unpaid carer seeking respite for a loved one. We therefore have a vested interest in reform of the structure and provision of social care in all 4 nations of the UK, in how people who deliver it are trained and have access to career development, but also how they are valued. To improve the quality of social care, we must invest in those who deliver that care. Caring needs to become a profession, and a profession that is respected.